Muscles of anterior thigh. Flexors of the hip joint. Muscles of anterior thigh. Number 1. Pectineus. Number 2. Iliopsoas, which is made up of a group of 3 muscles: the psoas major, psoas minor, and the iliacus. And the final muscle of the anterior thigh is sartorius. First of all, the first muscle, which is pectineus. Its proximal attachment is to the superior ramus of the pubis. Its distal attachment is to the pectineal line of femur, just inferior to the lesser trochanter. It is innervated by the femoral nerve, but it may receive a branch from the obturator nerve. Its main action is that it adducts and flexes the thigh, assists with medial rotation of the thigh. Iliopsoas. Iliopsoas is a muscle which is made up of a group of 3 muscles: the psoas major, the psoas minor, and the iliacus. Now, first of all, the psoas major. Psoas major has its proximal attachment to the sides of T12 to L5 vertebrae and discs between them. Transverse processes of all lumbar vertebrae. Its distal attachment is to the lesser trochanter of the femur, and it is innervated by the anterior rami of the lumbar nerves. Psoas minor. Its proximal attachment is to the sides of T12 to L1 vertebrae and intervertebral discs. Its distal attachment is to the pectineal line and iliopubic eminence via the iliopectineal arch, and it is innervated by the anterior rami of the lumbar nerves. Iliacus. Proximal attachment: iliac crest, iliac fossa, ala of the sacrum, and anterior sacroiliac ligaments. The distal attachment is to the tendon of psoas major, lesser trochanter, and femur distal to it. It is innervated by the femoral nerve. The main function, or the main action, of all 3 muscles which make up the iliopsoas is to act conjointly in flexing the thigh at the hip joint and in stabilizing the joint. Finally, we come to the third muscle, which is sartorius. Proximal attachment is anterior superior iliac spine and superior part of the notch inferior to it. The distal attachment is superior part of the medial surface of the tibia. It is innervated by the femoral nerve, and its main action is that it flexes, abducts, and laterally rotates the thigh at the hip joint, flexes the leg at the knee joint, medially rotating the leg when the knee is flexed. This brings us to the end of muscles of anterior thigh, flexors of the hip joint.